A hearty good afternoon and welcome to the session on Lock Your Fertility Gamete Embryo Freezing. We are glad to have Dr. Angad with us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Hi, thank you so much. Good afternoon, viewers. This is Dr. Sita Sharma from Apollo Fertility Amritsar. Today's topic is very upcoming with promising results, and you can say it is becoming the need of the hour also. And the topic is lock your fertility by gamete and embryo freezing. So let's discuss why do we think about this topic? Because today's woman is working woman, she is career oriented, and the fertility is also at the peak at the same time when the woman's career is at the peak. So I can say that it is in the late 20s and early 30s when the woman is pursuing her career and she is attaining growth in her career, and that is the time is to become pregnant also. So the fertility is also at the peak and the woman's growth is also at career wise is also at the peak. So what to do? We can go for egg freezing and we can go for embryo freezing. So let's talk in detail what are gametes and what is embryo. Gametes are the cells of the human body which are required for reproduction. So the female gamete is egg and the male gamete is sperm. So egg from the female and sperm from the male, they fertilize in the fallopian tube in the female body naturally, and then they form zygote. So zygote, and then it divides, cleavage embryos, then it forms the embryo. So 0 day, if we take fertilization day as 0, then day 1, day 2, day 3. Day 3 is 8 days, 8 cell embryo, and then day 5 or day 6 is blastocyst. So these are the gradings of the embryo. Starting from gametes, male gamete is sperm, female gamete is egg. They mate, fertilize, and then they divide in cells and they form embryos. So embryos can be frozen, and embryos can be frozen at 2 stage, day 8, day 3 embryo, 8 cell stage, or blastocyst is day 5 embryos. So who needs this embryo freezing? So embryo freezing is, or nowadays it is quite common. All of us, all of you who are going through IVF cycle or who are visiting the fertility clinic, they must be aware about the terms embryo freezing. Embryo is formed after fertilization, and in the patients who are undergoing IVF for any need, for tubal blockage, for male factor, for severe endometriosis, or unexplained infertility, or for anything, any problem that you have visited your doctors and doctor has advised you to go for IVF. Then after the stimulation protocol is given to the patient on day 2 of the cycle, woman is consulting the fertility clinic on day 2 of the cycle. Before that, male and female, both partners as a couple, they are reaching the fertility clinic and they have to undergo certain list of tests. Some general tests like HB, like blood group, like sugar and thyroid, some hormonal test also, and out of which AMH is very important in female. Second important is transvaginal scan in the female, and in the males the semen count, semen motility. These are the parameters in the semen analysis. So the semen is collected in the laboratory, in the hospital, in the semen collection room. You have to have 2 to 5 days of abstinence before giving your sample. Then the sample is looked for the count and look for the motility and look for the morphology, and these tests are done before we go for the IVF. And apart from that, viral markers like general test, liver function test, viral markers, your urea, creatinine, and ECG, these tests are also done. So once we take the patient for IVF, in the female we give injections, like these are hormonal injections that are given for roughly 8 to 11 days of injections are given, and one fine day when the follicles are mature, then we give trigger injection, and from trigger we give the time for, we can decide the time for ovum pickup. Ovum pickup is a procedure which is a small procedure which is done under short general anesthesia, short GA. It is a painless procedure. It's a 10 to 15 minutes procedure using the transvaginal scan with the needle attached on. It's a very fine needle through which the follicles are aspirated. Then this follicular aspirated fluid is handed over to IVF lab, where our embryologist process and see about the quality of the eggs, and the semen is taken from the husband. Then the fertilization process is done in the IVF lab itself. If we are going for ICSI, intracytoplasmic sperm injection, then the embryologist will inject one sperm into the one egg, and the fertilization is ensured. And then these fertilized egg is kept in the incubator, and they are cultured inside the IVF lab, and so that embryo is formed. And the embryologist will look for day 3 embryos, like 8 cells embryos, and then they will look the quality of the embryos, will look for the all the cells should be equal, and then we will inform the couple about the success of their fertilization and formation of the embryos. So now if the couple hormonal profiles are normals, their lining is normal, we can go for embryo transfer within the same cycle. Then we can do fresh embryo transfer, or we can freeze the surplus embryos. And sometimes in some patients the hormone profiles are not good. To avoid one complication like OHSS, ovarian hyperstimulation syndrome, we adopt the policy of freeze all embryos. So we can freeze all the embryos. What is freezing? Freezing is which is called vitrification. Freezing is the rapid cooling and storing the embryos at the sub-zero temperature. The sub-zero temperature is minus 196 degree centigrade. Their embryos are stored in a specialized containers in the liquid nitrogen, liquid nitrogen. And when we have to use this embryo, for example, if you want to conceive, you are ready to take the embryos inside your womb now, then we will in the next your cycle, we will prepare the lining of the uterus, and we will make the embryologist will make those embryo, take out those embryo from the cans. Freezing cans are there, cryo cans, and the embryos are thawed. They are made to come back at the same body temperature, and then we are transferring inside your developed lining of the uterine cavity, that is endometrial cavity. This procedure is not done under any kind of anesthesia. This is a very small procedure. It is done in the IVF OT, and with all the aseptic precautions, the embryo transfer is done. So who needs embryo freezing? Why do you want to go for embryo freezing? And number one, any couple who is going for IVF treatment, and for example they have surplus embryos are formed. For example, we have taken 10 oocytes, and out of them we have made 7 embryos, but we want to put 2 embryos at one time inside the uterus, and rest of the embryos will be frozen for the next future use. So when they need it in future, then there will be no injections are given for stimulation, no egg formation is done, because embryos we have already formed and we have already stored. So though as embryo we can use 2 embryos at one time. Sometimes if blastocyst, good quality blastocyst is there, we can use 1 blastocyst as well. So these embryos can be used for frozen use. And the patients who have a very low AMH, sometimes we go for pooling of embryos. We stimulate in one cycle, dual stimulation can be done, and we are pooling the embryos, and then there we can go for the embryo transfer. And in some patients, when we are predicting the possibility of OHSS, then we can go for embryo freezing. And some patients, if they are unmarried, so if they have not decided who will going to be their partner in case of females, so then what we can go for oocyte freezing or egg freezing. Egg freezing, egg is the gamete or the reproductive cell from the female. And when a female start menstruating, the normal ovulation starts taking place. Inside the body, one follicle, one oocyte is released every month. Because as the woman is now career oriented, if she does not want to conceive at the age around 25 or 30 years of age, when her career is at the peak, she wants to make more invest more time in the career, she is not ready for pregnancy now, so she can go for egg freezing. So egg freezing will lock her fertility, because the egg we will stored will freeze now, they will be at the same age, and she can decide for about her pregnancy at after the age of 30, say 38 years or 35 years. But the eggs, if are taken at the age of around less than 30 years, 29 years or 28 years, the age, the eggs will be at the same age, egg will be at the same age, but she can conceive after 35 years of age. What happens in female body naturally, when the age advances, your fertility starts decreasing. This is why, because the female is given, god gifted by a fixed number of oocytes, fixed number of follicles when she is born, and these follicles, they start decreasing with age. After the age of 37 years, there is a steep decline in the fertility. This is because the egg number and the quality of the egg in the female, they starts declining steeply with age. So as the age advances, the number of eggs and quality of egg is going to deteriorate in the female body. That means the potential to become pregnant or the fertility potential is declining. By oocyte freezing, you can lock your fertility at a younger age. So who should come for the egg freezing? Any patient who is having some medical illness like cancer. If there is cancer of the breast or cancer of the ovary or any other cancer which is needing surgery, or which is requiring to go for chemotherapy or radiotherapy, chemotherapy and radiotherapy, they are going to deteriorate the life of the eggs, they are very harmful to the health of the eggs. So you can think of going for egg freezing. And second indication is, nowadays it is very common, I am seeing the women having premature ovarian failure. Even girls at the age of 29 or 30 years, they are having very low AMH. AMH is anti-Mullerian hormone, which is a kind of mirror image of your ovaries, which will roughly tell, which can tell us about your fertility potential. If the AMH is less than 1.2, that means you should become cautious. Now your AMH, your fertility potential is falling. So I'll advise all these females, they can think of going for egg freezing, because when the AMH falling, at least when you are in a younger age, we can get eggs with good health, eggs of good quality. But after the 35 years of age group, the quality of the eggs also falls. The quality of the eggs is also declining. This is because there is a risk for chromosomal abnormalities which increases with age. So the eggs with abnormal chromosome or abnormal results, there is increased incidence of going for this miscarriages results. So the early pregnancy failure is very common after pregnancy is achieved after 35 years of age group. This is again because of the decline of the egg quality. So you can think of going for egg freezing at the younger age, around 25 to 30 years of age, if your AMH is falling. And if you are having a grade severe endometriosis, grade 3, grade 4 endometriosis, in these cases also the AMH also falls. Endometriosis is a condition in which the normal endometrium which lies inside the uterus is now lying outside the uterus and impending on the ovaries. So it is forming the endometriotic cyst. Very commonly they are known as chocolate cyst. In the patients who have severe endometriosis, they have severe pain, and their fertility also is falling. So those patients can also think of going for egg freezing. So what is the right age for egg freezing? And I will suggest when your quality of the eggs is good, that means in the late 20s or in the early 30s. You can say between 25 to 35 years age is the best for going for egg freezing. But if you are having some kind of cancer like illness or any other illness which is harmful for the life of your health of your eggs, you can think of going for egg freezing even in early ages also. Apart from egg freezing, in certain cancers, when they have no time they want to start chemotherapy as early as possible. And then egg freezing के अलावा ओवेरियन टिश्यू कैन बी फ्रीज्ड, ओवेरियन टिश्यू को भी फ्रीज किया जा सकता है. And because when we are going for egg freezing, we have to stimulate the ovaries to produce more follicles, and this starts usually in the day 2 of the cycle, menstrual cycle के दूसरे दिन शुरू करते हैं. लेकिन अगर हमें oncologist ने कुछ 15-20 दिन का टाइम ही दिया तो we can start the stimulation at any time. So we give the injections from 8 to 11 days injection देते हैं. Depending upon that the follicles will enlarge. We can see them on ultrasound. हम ultrasound करके उसको follow करते रहते हैं. And depending upon when the follicles become mature, then we give trigger, and after the trigger, after 35 to 36 hours, we take out the eggs, and that procedure is known as oocyte retrieval or ovum pickup, which is done in the IVF OT under short anesthesia. It is totally painless procedure, and complication rate is very less. It's almost safe procedure. So the best age to go for embryo egg freezing is when we can get the good qualities of the eggs, that is less than the age of 35 years. And then now who needs it, why we need to do it? And because as I already told you, when your fertility potential is declining, you can get it done by knowing your AMH, or in cancer patients or any other disease in which the therapy is required or surgery is required, which will later on hamper the number and follicles in your ovaries. So you can think of it. But once you have freeze the eggs, if you go on for freezing your eggs, how can you use it later? Like for example, you have frozen your eggs at the age of 27 and you want to have pregnancy at the age of 38 or 39 years, and after say you are married after the age of 30 years, so you can try for your natural pregnancy also, because if you conceive in natural pregnancy there is no need for going further. But if you are finding it difficulty in conceiving and now you are married or you have chosen that who is going to be your partner, then we can take sperms from your partner, and then the embryologist will make the embryo this eggs thaw again, and then we can fertilize with that sperm and the embryos will be formed, and that embryo transfer can be done inside the your uterus again, and you can become pregnant. And how safe is one question is some of the viewers that how safe is egg freezing. Egg freezing is if I consider about how will you use the eggs, these frozen eggs can be taken out of the can and then they are thawed, and there is almost 80 to 90% retrieval rate of the eggs is there. Human egg is the largest cell in the human body which contains lots of water. So earlier techniques, because the embryology has now advanced techniques of vitrification is there, which is ultra rapid cooling of the eggs, so there is no loss of eggs because of the ice crystallization formation. So we can save the eggs, we can retrieve back the egg by 90%, and 40 to 50% results are now seen in the studies about the fertilization rate also. So these eggs can be used, they're very safe, there is no extra risk till now as per the studies that came. You must have heard about the US study. Their 25 years old egg was used for fertilization and they got good results out of that. So how long these eggs or embryos can be frozen? So it can be frozen from, you can say, 1 day till how many, till indefinite years you can freeze them. So there is no end to that. You can keep long, or you can use it after 5 years, 10 years as per as your requirement is. So they can be frozen for n number of years. And now I come to the male partner, and male gamete, as you know, is the sperm. They are usually, it's easy to retrieve because the reproductive system of the males lies outside the body, and the male is advised not to have alcohol for 2 to 3 days before giving sample for freezing, and they should have abstinence for 3 to 5 days only, not more than 1 week and less than 1 day. And then the semen is collected and it is processed and the semen is frozen. The best quality, the semen is frozen. So what are the conditions in which person should go for semen freezing or sperm freezing? As if there is any illness like cancer, in which the male has to undergo chemotherapy, radiotherapy, or surgery, or any other condition which is going to harm the health of the sperms. And in a routine IVF also, we take one sample as a backup sample for semen, and we freeze it as a routine also, because what happens, some of the males, they feel difficulty and under the stress when they are asked to give sample today only, they find it difficult to give the sample. So we always keep one sample as a backup sample in the laboratory, so that when we are going for ovum pickup, and we have to form the embryos in the couple, then we should have a semen sample readily available for us, so that we should not go for the egg freezing. Once we have planned the cycle as embryo freezing, and if the semen sample is not available, we have to sometime convert the cycle to go for egg freezing only. But we want always keep one sample ready. Or sometimes what happens, if some persons are working in army or husband is not available for treatment, then they can give their sample for this freezing, and we can use it for future use. I think that's all for gamete and embryo freezing. If you have any question, you can ask, or you can put it in the comment section. I'll be happy to reply it later. Any questions? So thank you, viewer. You can put your, if you later want to ask any question about this, you can put your questions or comments in the comment box, and I'll be happy to answer that. Namaste.